Longitudinal Study on Prenatal Exposure to Cocaine by Kelsey Clark, Elizabeth Beckman, and Benjamin Schultz. Experimental Report, Prenatal Cocaine Exposure and Child Outcomes, a conference report based on a prospective study from Cleveland, was written by Lynn T. Singer and contributors Sonia Mines, Mi-Young A. Min, Barbara A. Lewis, and Elizabeth J. Short. It was published on July 28, 2015. Before explaining the purpose of the study, it is important to give a little background information on cocaine first. Cocaine is a highly addictive stimulant drug, and it comes in two forms. Pure cocaine is unprocessed powdered form, and crack cocaine is the processed crystallized form. Cocaine stimulates the sympathetic nervous system, which leads to effects such as increased alertness, decreased fatigue, and suppressed appetite in users. It also increases dopamine levels in the brain, which creates a strong feeling of euphoria and an intense high for users. Before the study, researchers were already aware that prenatal cocaine exposure could lead to several potential disruptions in fetal development, such as defective synaptic development, in which the cocaine could potentially alter dopamine receptors in the fetus. Another concern was hypoxemia, caused by decreased uterine blood flow and oxygen deprivation. Lastly, vascular disruption was a concern because it could affect the development of neurons in the brain. The cocaine epidemic of the 1980s and 90s caused nationwide concern about the effects of cocaine. Since many users were women of childbearing age, it was also important to study the cocaine's effects on offspring development. The National Institute of Health funded studies to evaluate the developmental effects of prenatal exposure to cocaine. The researchers' objective was to be able to describe the developmental outcomes of prenatally cocaine-exposed infants from a longitudinal perspective. The study investigated how cocaine affects cognition, language, neuropsychology, and behavioral functioning.
The researchers of this study wanted to watch infants who had and hadn't been prenatally exposed to cocaine over time. This study looked at 197 non-exposed infants and 218 exposed infants at the 6-month mark, 1-year mark, 2-year mark, 4-year mark, 6-year mark, 9-year mark, 10-year mark, 11-year mark, 12-year mark, 15-year mark, and 17-year mark to see how they develop differently over time. Over these 17 years, researchers saw significant neurotoxic effects of cocaine exposure. Specifically, researchers saw deficiencies in head circumference, length, and weight. Researchers also noticed poor visual attention, jitteriness, and a higher chance of motor and tone abnormalities. Visual attention and discrimination were also found to be deficient. Researchers also looked at some facts about cocaine abusers. This and other studies found that cocaine-using women were older, had more children, had less prenatal care, were less likely to be married, had lower IQ, and were more likely to use large amounts of alcohol, marijuana, and tobacco while pregnant.
Another interesting thing that this study showed was how in children that were exposed to cocaine and taken into foster care later on showed more aggressiveness and had trouble with social interactions and thinking and attention and delinquent behaviors, as opposed to children exposed to cocaine that stayed in their birth homes. This is pretty interesting since most people would think that taking the child away from cocaine-using parents would be beneficial, but research in this stated that it may not be. The overall findings of this study showed that cocaine had lasting effects in cognitive development, it had growth and maturity problems, and it leads to higher risk in drug use later on for children that are exposed to prenatal cocaine. The study also showed research that suggested heavier exposure to cocaine that made all of these effects more significant and pronounced. This study was very important because We need research like this to help prevent cocaine addictions and use. Many cocaine users are women of childbearing age, and the children of these women are born with cocaine addictions and need weaning off and need help to be able to revert back to normal life. Studies like these help us learn more about how to help these children and help prevent instances like this from happening. In conclusion, this study has shown us the importance of cocaine research, and it showed us that cocaine affects individuals at many different levels, referring back to cognitive, growth, social behavior. This study also can help prevent children and adults from cocaine use and addiction, as we talked about on the previous slide. So this type of research is very important and very needed.